What do you fancy to work with in plastic surgery? What's your main topic of interest in plastic surgery?
Well, I have actually several topics, but basically what I enjoy doing, I do only aesthetic plastic surgery, and I enjoy making people happy. So that's basically my favor. And from surgery point of view, I like to do facelift and eyelids, and I like to do breast surgery. So that's kind of my favorite subject of surgery. I do the Belgium-inspired facelift, the max lift, the minimal access cranial suspension, and I do it very much in the way Patrick Turnado and Alex Trapelo does it. I was taught by them, and I've added lipofilling to the facelift as they do it, and I do it very much in the same way as they do it.
Perfect. You know, we are all standing on giants to reach the top, and we have all learned from the masters.
Yes.
What giants are you standing on? What's your models in plastic surgery?
Well, the model is maybe the feeling of what do we like in Denmark and in Scandinavia. I think we can put it that way, because we would like to have plastic surgery done without it being noticed. So it is the natural way. It has to look good, but it doesn't have to be seen. So that's what I favor. So of course I have been traveling pretty much in the United States, watching several American surgeons and famous surgeons, and they are very, very skilled and very, very exclusive. But I think from a Scandinavian or a Danish point of view, sometimes they do a little too much. So, so from a standpoint of facelift, I think the short scarf facelift is a very good facelift, because it keeps you natural, and it's very hard to see afterwards, even for a professional, that you have had surgery. And also with breast, most of the time I put my breast implants beneath the muscle, and especially because it gives a more natural look. To me, I feel it's more safer as well, and it stays more steady. So that's also why I put it there. But basically, it has a much more natural look. 2/3 of my patients, breast augmentation patients, prefer the anatomical shape. So that's also another way of looking at augmentation. It has to look natural.
Perfect. What do you think are the main progresses in both reconstruction and aesthetic plastic surgery? What do you think are the inventions and the progresses for the past years?
Well, I think due to a high demand, we have had to be more skilled and to learn in what field we can work. And I think we have become more knowledge, and due to that knowledge we are better surgeons, because we know how to dissect and do the right indication and do the right operation. And today what we do, we have a lot of tools that can help us, but basically the newest tools, and that will also be the future tools, is that we have learned to transfer fat from one place to another place. It's helpful in many ways. It's helpful in rejuvenation, but it's also helpful in a reconstruction way. And that is, I think, probably the greatest inventor for the last 10 years. And we did lipos and lipo transplants, but it wasn't acceptable. We were afraid that it didn't work, but now we realize that it works in the right matter. And of course you have to still have the right indication to do a good job.
Thank you very much, Poul. I'm happy that you have been here and contributed to our knowledge in plastic surgery.
Thank you so much. Thank you for being here.